Good afternoon, Leo. Thank you for chatting with us.
No problem.
Leo, how old are you, sir?
76-year-old white male.
Okay.
Play golf tomorrow.
And your operation was 5 weeks ago.
October the 2nd.
And when did you get rid of your cane after surgery? How many weeks?
I bet I didn't use that cane 2 weeks at the most after. Walker for 2 days, and the cane, the rehab guy took that away from me 3 days after that. I was walking without either one of them. God be my judge.
And you've been feeling good to do all normal activities for the last 3 to 4 weeks then, correct?
Well, not normal. I haven't played any golf, and I haven't chopped any wood, but I'll be doing that tomorrow because you just gave me the okay.
That's great. And would you say that overall your hip replacement was less stressful than you expected, or pretty much what you expected?
Well, actually, I was surprised. It was better than I was nervous, scared to death. And I did say a lot of prayers, but no, it was terrific. I had no problem at all.
Well, we'd like to thank you for chatting with us. And if anything you'd like to say to our patients who watched us?
Well, the only reason I chose this guy to do my operation is I seen a TV ad, and he had an 86-year-old lady that had her hip done. And I said, boy, if it's good enough for her, he's good enough for me.
Well, thank you very much, Leo, and have a nice day, and say hello to your lovely wife.
I will do that.
Thank you. Hold on. B, if you could walk towards us, please. Okay, if you could turn around and walk back again. Okay, and come back one more time and stop about halfway. You could stop right there. Could you kind of squat down a little bit for us? Come on up. And thank you for speaking with us. How long ago was your hip procedure?
My surgery was 2 weeks and 2 days ago, 4 to 16 days ago.
And what did we do to you?
We had a total hip replacement in my left hip.
And how do you feel right now?
I feel absolutely fantastic.
Could you tell us how tall you are?
I'm 5'10".
And how much do you weigh?
About 230 pounds.
And how much pain did you have after surgery?
I actually had absolutely no pain at all. As a matter of fact, when the nurse came in the morning after the surgery, they told me I never even used any of the pain medication.
And did you ever use crutches or a walker?
I used a walker as I walked down to physical therapy the morning after surgery. Immediately went on a cane. I did steps that morning, and that afternoon during physical therapy, they had me walk from the 3rd floor to the 1st floor of the hospital and back down again.
Before surgery, how much pain were you in, sir?
I had gone through a tremendous amount of pain. My hip deteriorated very, very quickly. This is the greatest thing that ever happened.
So would you say you're overall happy with your experience?
I am ecstatic.
Well, thank you very much, and thank you for letting us film you.
My pleasure.
Have a great day.
Thank you.
Okay, Ronnie, come on towards us.
Okay.
You want to stop right about there? You want to take a hop, skip, and a jump here? Can you bend down for me?
Yeah.
Great. And how long ago was your surgery, Ronnie?
December 22nd.
How many weeks from today is that?
It's been about 6 weeks.
And when did you get rid of your cane?
Actually, I only used the cane for about 4 or 5 days, less than the first week.
And you've been back to doing normal activities for how long?
Actually, I'm not supposed to say this, but I started driving in about 2 weeks.
And
Yes,
you had
no
your other hip done through a traditional approach. How was the rehab for this compared to the other one?
Oh, it was a lot better. It appeared to be a lot less muscle damage, and I was able to manipulate my leg and just really didn't have any trouble at all.
So you were walking a lot better almost immediately?
Yes, and sleeping better than I ever had.
And so all in all, you'd say that the minimally invasive approach was very helpful to you?
Yes. Yes, it was.
Anything you'd like to say to your fans on the internet?
What I'd like to tell everybody, the old tradition, wait as long as you possibly can, don't do it. If you're in pain, you need to get this done because you get out of pain and back to normal life.
And the JointEx experience was very positive on the floor?
Yes, very positive.
Well, thank you very much.
Thank you.
Good morning, Steve. Thanks for meeting with us. Could you take a stroll towards us?
Christmas.
And could you stop there? And could you back up a bit? A little more. Okay. Can you squat down for us? Come on up. And you had your hip replacement surgery done on the minimally invasive Hanna table how long ago?
About 6 weeks ago.
And when did you go back to work?
That same week, Friday.
So we did you on Monday and you went back to work Friday.
Correct.
When did you get rid of your cane?
Following week.
And so you were walking essentially without an assistive device at,
About a week after the surgery.
and you were able to get back to your normal activities by how long?
About 10 days.
And how would you describe your experience with the minimally invasive approach and the JointEx program at the Good Samaritan Hospital?
Absolutely outstanding from beginning to end.
And what do you do for a living, sir?
Investment advisor.
So you're reasonably discriminating?
Absolutely.
You're high maintenance? Would you describe yourself as high maintenance? All right. Is there anything you have to tell our folks who might be viewing this?
Only that if they were going to consider a surgeon, strongly consider using you and your team.
And do you think you waited too long before you did this, or?
Should have had it done probably a year before. So I limping around for about a year. I should have came in about a year sooner. So I'm glad I came here, and I'm very pleased with the results.
Well, listen, happy holidays, and thanks for chatting with us.
Thank you very, very much. Appreciate it. Thanks.
Hi.
Good morning, Steve. Thanks for meeting with us. Could you take a stroll towards us? And could you stop there? And could you back up a bit? A little more. Okay. Can you squat down for us? Come on up. And you had your hip replacement surgery done on the minimally invasive HANA table how long ago?
About 6 weeks ago.
And when did you go back to work?
That same week, Friday.
So we did you on Monday and you went back to work Friday?
Correct.
When did you get rid of your cane?
Following week.
And so you were walking essentially without an assistive device at,
About a week after the surgery.
and you were able to get back to your normal activities by how long?
About 10 days.
And how would you describe your experience with the minimally invasive approach and the JointEx program at the Good Samaritan Hospital?
Absolutely outstanding from beginning to end.
And what do you do for a living, sir?
Investment advisor.
So you're reasonably discriminating?
Absolutely.
You're high maintenance? Would you describe yourself as high maintenance? All right. Is there anything you have to tell our folks who might be viewing this?
Only that if they were going to consider a surgeon, strongly consider using you and your team.
And do you think you waited too long before you did this, or?
Should have had it done probably a year before. So I limping around for about a year. I should have came in about a year sooner. So I'm glad I came here, and I'm very pleased with the results.
Well, listen, happy holidays, and thanks for chatting with us.
Thank you very, very much. Appreciate it. Thanks.
Hi.
Okay, you're a movie star. Come on up, Mr. B.
Oh, I'm going to come right on up there for you, sir.
Okay. Could you stop right there? Can you bend down for us?
Sure.
Stand up. Good. And why don't you turn away and walk back one more time? Give us your beauty pageant walk there, sir.
And one in front of the other?
Yeah, that'd be fine. And come on back one more time. I'm going to ask you a few questions. Okay. If you stop right there. How long ago was your hip replacement, sir?
6 weeks and 2 days.
And you had your other hip replaced several years ago, is that correct?
That's correct, 5 years ago.
How would you compare the two?
Night and day. This new procedure is a wonderful thing.
Were you on your walker for how long?
2 weeks,
And when did you start walking normally, would you say?
5 weeks in.
And would you say you had, with the pain management, better this time?
Pain management was better this time.
Did you have much discomfort?
Only some lots of muscle soreness, but that's the only discomfort.
And since, with your previous operation, you weren't part of the JointEx program, would you say that was a positive experience?
Yes. Yes, it was. The best experience I've had. The previous experience for the first one is not comparable to the joint, what do they call that? The JointExperience here at Good Samaritan. It's different between night and day from 5 years till now. So,
And you're back to work?
back to work.
Would there anything you'd like to tell our folks?
They did a wonderful job, and I appreciate it, especially the physical therapy department, and of course the surgeon did.
Well, thank you very much. We'll see you soon. Have a great day.
Thank you.
All right, Mr. B, come on back towards me, Mr. B. And don't mind the hecklers here in the therapy gym.
Right.
All right, you can stop right there, sir. Could you actually have a little chat with us? How long ago was your hip replacement, sir?
Tuesday, 2 days ago.
2 days ago. And how do you feel?
Good, right?
Compared to your other hip replacement, was this quicker, slower, the same?
Oh, it is 1,000 times quicker.
And so you're able to walk now with the cane at only 2 days, is that correct?
Yeah.
Would you mind telling us your size, height, and weight?
Height, 6'4", weight above 300. That would be good.
How much above 300?
Oh, about 60 pounds more than that.
About 360, okay. And how's the JointX program been treating you?
Very good, great people.
So you think that with that anterior approach to the hip, you've been able to rehab much faster?
Much faster, really 1,000 times better.
Okay.
Very little pain, walking around, doing everything.
And you're going to attribute that all to the incredible therapy you've gotten from your therapist here, aren't you, sir?
Absolutely.
Very good. There she is hiding in the corner there. Hi, Megan. All right, why don't you just give us a walk back to the chair, and thank you very much.
Okay, thank you.
There you go. But very good, sir. Have a good day.